And hello, Anna.
Hello.
Nice to see you. Thank
Hello,
you for joining
Georgie.
me.
You're very welcome. Thanks for asking me.
So we'll probably just have a bit of a chat until people start joining us.
Okay.
And then it's going to be recorded and we'll put it up on YouTube anyway, if anybody wants
Okay.
to catch up there.
Yeah.
And yeah, let me know if there's a problem with the sound still. I know we had a bit of a problem before we started, so we'll
Okay.
see how
Yeah.
we go.
Yeah.
While we're waiting for people to join, shall we start with you just telling us how you got into this work and what I know you're a GP, aren't you? And you do some NHS work, some private work.
Yeah,
Um,
that's exactly right. Yeah. So
yeah.
I've been an NHS GP for like 29 years. Um, and I've always been interested in how other things affect health, like lifestyles. And that's probably where I started, if I'm honest, looking at how people eat, sleep, move, relax, and how that affects people's health, basically.
Mhm.
Um, I then about 7 years ago, I was sort of, general practice was pretty stressful, and I thought, oh, what can I do that would use my skills, but it's a bit different. So I got into medical acupuncture,
Right.
and through that, I really saw in more detail about how people's lifestyles affect their health as well as stress.
Mhm.
Okay, partly because I had much more time with patients, so it kind of developed my interest even more. So I kind of went on to do my lifestyle health diploma, and was very interested in that. And then obviously in acupuncture you see more of it even than general practice, but you still see a lot of it in general practice, is chronic pain and medically unexplained symptoms. And I
Mhm.
started reading around the subject and listening to people like Howard Schubiner on radio programs and things. And then SERPA was mentioned because I didn't know that SERPA existed.
Mhm.
And then I trained with SERPA in mind body medicine, and it's been
Yeah.
absolutely fantastic. It's been like
Right.
for me the missing piece in the puzzle,
Yeah.
completely.
I think
It's
that's often the
opened up
case,
my
isn't it?
eyes. Yeah.
Yeah. And
Yeah.
then you just sort of start seeing how it's not lifestyle, it's not stress. All of it is so intertwined, isn't it? Sort of mind, body, spirit,
Completely.
lifestyle creates so much. In fact, I was going through a case study recently because, as you know, when practitioners become students become practitioners, then they do case studies. And I was going through one,
Yeah.
and almost all of it was about lifestyle, the busy, the busyness of
Yes.
lifestyle, and then the personality that then, makes it worse by needing to be seen to be doing well, needing to be in control, a perfectionist, overly analytical.
Yeah.
These are all part of our life, that there's part of our lifestyle, but then also creates stress as well. Before we move on, I just want to say hello to people who joined us. Please do put a comment on. Nice to see you. Please do put a comment. Let us know where you are. We will keep chatting for a little bit. If you've got any specific questions you want us to answer, then please do ask. And also, because we had a sound issue before we came on, and we weren't sure what side it was coming from, if you find that you can't hear me at all, or I keep breaking up, then please do say something. Otherwise, we'll assume everything's all right. So otherwise, there's a few people who've joined us. Please do just comment, put in the comment and say hello. It's nice to sort of see comments rather than just numbers. But yeah, so we're talking about lifestyle, about stress, about medically unexplained symptoms, which are explained, but not by the conventional medical world.
Yep.
Functional neurological disorders, all these different terms for what are generally mind-body conditions. So yeah, so as you were saying, it felt like it was sort of the missing piece in your work as a
Yeah.
GP.
Yeah,
Mm.
and I think, like you say, nowadays our lives are so busy. We can be constantly distracted, constantly busy, and
Mm.
we get kind of caught up in it all. So we're not being chased by a lion anymore. We're being chased by emails or
Yeah.
deadlines, or I don't know, getting ready meals for the family and looking after elderly parents, etc., etc. We're just not built for that constant level of
Mm.
intensity of distractions and things going on, really.
No.
Um,
Mm. And in the past, pre-cars, people walked everywhere or they
yeah.
rode their horse or whatever, but they always, children, okay, I know my grandmother used to walk 5 miles as a small child to school and back. But this is great because it actually gave them time to just sort of, maybe if there was bullying, they could at least sort of process some of it, or walk it off, or like we now exercise, we now do shaking meditations or something. Whereas actually in the past, we didn't need to go to the gym because we were already exercising so much anyway in our work, and now everything is made so much easier for us that we have to go to the gym or go out for a run to exercise.
Yeah.
I just want to say hello to Lynn, another GP who's trained with us. Nice to see you, Lynn. And I'll see you in a few weeks because we're arranging a get together with people in the Southwest when I go down to Devon next. So that's always nice. Yeah, it's always nice when we can get groups of, which we do a lot, don't we, either online or offline, groups of practitioners, because we all need support. It's quite an isolating field to work in, isn't it?
Yeah, we do need other people. Yeah.
Absolutely.
Very
So
much
you, sorry, go on.
I was just going to say that connection, the constant distraction. And one of the other things we also did, I think, like your grandmother used to walk to and from school like that, and so had kind of time, just being. Now we have phones, we can actually disconnect from people, and how it's a great connection in the sense we can do this kind of meeting, but it's not real connection like being with other people and having that real human face-to-face connection. And I think we're all very busy, and so that gets a little bit left behind as well.
Yeah, absolutely. I think we know that communication is so important, and yet in this day and age, everybody moves away, and we don't have that family unit that we used to have. And that's even pre-pandemic was a bit easier than now, wasn't it? Now everybody does everything online. But being able to see each other and physically see each other rather than just online, I think it's really important. Well, an example of this is, we as you know, we have a board, a SERPA board. So we have 8 of us now on the board of experienced practitioners that's been going for 2.5 years now, and they work with me to provide support for our membership, which is made up of practitioners, as you know, who've done the training. And we meet online to discuss things so often, and we've become really good friends anyway. And we often will meet in pairs. But when we meet for a weekend, like we did, we're starting to plan the next conference. So at the beginning of January, we all stayed in an Airbnb, and we all really work together. It's so much easier to do it when you're all together rather than having to take it in turns and be careful you're not talking over each other. But not only that, but there was so much more personal sharing and discussion, and we were just saying how much easier it is and how much nicer it is when you are face to face rather than just doing it online. There's something completely different, isn't there?
And I think you learn so much from other people, don't you, by talking and sharing, and things that have bothered you. Sometimes share, a problem shared is a problem halved, and sometimes having that connection, someone saying, well, that happened to me and this is how I managed it, can be incredibly helpful and supportive as well.
Yes, absolutely. I experienced this myself over the weekend, where there was something that was bothering me, and I journaled about it, and I've been doing my own self-care. But I hadn't actually shared it with my husband at that point, partly because he goes out gritting when it's really cold. So he'd been spreading salt and so doing nights. So we hadn't had much time. But then on a Sunday, we sat down and I offloaded and talked to him. And I felt so much better for that. Just being heard, being understood. Yes, and it just made a difference.
And I think that sharing with someone you trust is really important. It's very different from going around just telling everyone you've got this problem and almost energizing it by just blurting it out to anyone you happen to see, versus having that very sort of intimate, vulnerable conversation with someone like your husband, or maybe a close friend or a counselor, where that's very different. That's kind of trying to slightly unwind it for you.
Yes, yeah, absolutely. And I think very much people are fearful of showing their vulnerability these days, probably in the past as well. But
I think I might have lost connection. I can't hear anything, just so you know.
So Lynn, if you're still there, and anybody else, can you still hear us? Is there a problem from here? Can you hear me again now, Anna?
I can't hear anything.
No, oh no. Anybody at the other end? Can you hear me? Oh, both of us. Is there an issue from your end? Right, okay. Well, let's wait and see if Anna can come back. Right, thank you, Lynn. Thank you, Liz. Thank you, Anne. So it looks like it must be a Wi-Fi issue. Anything, Anna? Anybody got any questions while we're waiting for Anna?
I can't hear anything.
No. Thank you, Fiona. Nice to see you all here, by the way. Oh, can you hear me now?
I can hear you. Oh, I can now. Sorry, I've completely had nothing. I've heard nothing for the last minute or so.
Are you sure it's a techie issue, or is it your ears just not wanting to hear? Well, it sounds like everybody else could hear us, and I could hear you. So maybe it was a Wi-Fi problem. But anyway, yeah. Oh, yeah. So I was saying about vulnerability, about how hard it is to share our vulnerability in this day and age, maybe before now. But and I know when people say, "Oh, I can share I can share that I'm vulnerable," and I think of that personally and think I can share my vulnerability. It's very easy to say, "Oh, last week I had a meltdown," or this happened, that happened. But how many of us in the moment, when we're having a meltdown, would we actually reach out and call somebody or ask somebody to help us or whatever? Now I can with my husband. I'm very lucky. If he's around, then I can do that. But it's only probably been in the last 2 or 3 years that I have been able to actually bring a couple of friends. No, probably I have done in the past maybe, but not often and with difficulty. Because you're showing your vulnerability. And that's scary, isn't it? If you've been taught to shut down your emotions and not to share things. And that's the trouble, is that by doing that and we shut things down, that's when we manifest symptoms.
I also think with vulnerability, you need to be very secure in the person you're talking to.
Absolutely.
And you sometimes want them to be the almost emotional adult to your vulnerable inner child expressing yourself.
So holding the space.
Holding the space, exactly.
Yeah.
So rather than, if you are talking about a difficult emotion, then going, "Oh, don't worry, I'm sure you'll be fine, it'll be better," which is really not very helpful, because that's them sitting and they're not feeling comfortable, so they're trying to make it better for you. What you want and what you sometimes have to say to the other person is, "Look, I need to be vulnerable with you. I need to express these emotions about X and Y. Would you mind just holding the space for me so that I can express myself? I don't want you to make it better. I just need to express it. And you just be there in that space with me, but not trying to make it better or fix it."
Yes. Yeah, absolutely. And I think I might have mentioned this with one of these calls before, a long time ago, but I mean, I've been married now for 36 years. All right. Yeah, nearly 37 years. And I remember in the early days when I would be upset, the first time my husband was busy saying, "I don't know why you're so upset, and you just need to do this, this, this." And I didn't say anything at the time, but after, I think it was the next day, I said, "Thank you for being there. But, I needed to listen. I really just needed to express and to listen." Now, bearing in mind, we were in our 20s, late 20s. And I said, the next time it happened, however long after it was, he just sat there, didn't say a word. He just sat there, trying to do his best, which was lovely, but it felt a bit awkward. So I just said, the next day, that was lovely. Thank you so much. However, next time you just going there, holding me and just saying, "Yeah, no, I understand," or whatever. And then after that, it was fine, but he just needed teaching. how to deal with an emotional woman.
Yeah.
But you're right, and we have to have trust in that person as well, and that's really important. And I've had too many people that just say, don't. Yes,
we need to teach the other person, maybe our half or our best friend, and say, look, I just need you to tell you this, and I need you to be the adult and hold me in that moment rather than fix me. And you need someone to explain that to someone. I think you're right. Yeah, because they don't know necessarily.
No, not to begin with. No, absolutely. So we've got quite a few people listening in. If you've got any experiences like this, or if you're just laughing, fine. Or, you know, if you've got any questions, then do post them in the chat. Otherwise, we'll just keep talking about various things. So moving on back to you then, Annie. I know you do some private work as well. Is that because you couldn't fit all that you wanted to do within your short NHS GP slots that you're given?
Yes. It's very difficult in sort of 10-minute consultations, trying to even there's various things you're doing as GP, and one of the things you need to do is make sure the symptoms aren't pathological. Okay, so there is a certain amount of investigating and need to hear the story, etc. But in the short time, you're really trying to exclude anything pathological or nasty or cancers, infections, etc. And in a way, when you've done that, it's like as a GP, you slightly tick the box. And there isn't an awful lot of time to talk about other things. So you might mention stress or lifestyle it might be a factor, but you don't really have much time to go into any more detail. I tend to resource my general practice patients quite a lot now, which at least is helpful, you know, books and podcasts, websites, etc. And we now have a sort of a text we can send them with that information on, so that's helpful. But yes, I mean, that's the thing in my private practice, you know, I spend a lot of time. So in my first consultation, you know, I spend 2 hours with a patient, because I really need to understand what really has gone on and who they have seen and what treatments they've tried, etc., and what's happened to them, what is their story.
And it's sad, isn't it, that so many will say, I'm sure many of your patients as well, will just say, you know, nobody's ever listened to me before. And as you were saying that, you know, about 10-minute appointments, is it any wonder that it takes so long for beliefs to change, when every time when they're going to the doctor, all they're basically being told, well, we need to do this test, rule this out, but no time to actually listen to and start getting a clue that, well, maybe it is because your mother just died or whatever it happens to be. And then physiotherapy appointments in the NHS, you know, they're sort of 20, 30 minutes. They're not very long. My results improved just by going privately because I gave people longer. We're still at that point doing the same treatments, but I was giving them longer. I think, and the trouble is in the NHS as well, not that I'm needing to diss the NHS, but recognizing, you know, somebody is referred for neck pain, as you know, as a GP, physios can't treat them. If they then say, oh, my neck's much better, but now I've got back pain, they can't continue to treat that. They have to go back to the doctor and be re-referred, which is ridiculous when we now know that it's all interlinked.
Yeah.
So
I think
no
also
wonder
in
it takes so
traditional
long.
medicine, we're very good also at diagnosing and treating, and not really looking at the story behind the diagnosis, behind what the symptoms are.
Really treating the symptom, and that really is medical practice more than anywhere else. You know, whether that's back pain, hip pain, whatever it is. Look, you've got that degeneration there. That is the cause of your pain. It doesn't matter about the evidence because they're so busy they don't have time to even sort of keep up to date with all of it anyway. But I just think that's so sad because that's still keeping, you know, everybody very much in the biomechanical and the symptom. Let's treat the symptom, not recognizing that, yes, if you continue to treat the symptom, then actually that might get better. Very strong placebo effect, as we know, somebody in a white coat, or especially with, you know, going into surgery. And we know the power of the placebo, but more often than not, down the line, there's another pain that comes up. And certainly I see people who've had a knee replacement, and then a hip replacement, and then another knee replacement, without actually looking at what's causing the pain to come on, and why would the pain suddenly come on when arthritis takes years to develop. So why overnight? In fact, I was saying recently to somebody that somebody I know had heart surgery, and then the next week after coming home began with growing pain, and that became worse and worse and worse over the next 2 or 3 weeks, and then started going into a typical arthritic hip pattern. And this was before I knew about Dr. Sarno, and I remember as a physio being completely bemused, thinking, why? You know, I actually rang the cardiac unit in Leeds, the physios there actually, and said, what do they do in surgery? Do they sort of, you know, hold them by the ankle and sort of whisk them around, you know, around their heads? So they end up with hip pain? Obviously not. But I was so shocked by how quickly the function was lost, the pain came on, and the mobility was affected. And when, so sort of as it started going into that hip pattern, I referred him for an x-ray, and it turned out that he had no cartilage in that hip, and it was bone on bone. But that never made sense to me, because you don't just have heart surgery and then suddenly lose your cartilage in your hip. That had been going on for years. So why suddenly have that pain? And the interesting thing was that the other hip hardly had any cartilage in it at all. And yet, for the next 15 years before he died, he didn't have any pain in that hip, never had any problem in that hip. And it wasn't until I came across Sarno that I then looked back and went, oh yeah, okay, now I know. And I knew him, and I understood why that pain would suddenly come on. But yes, but if we're only treating the symptoms and GPs are only able to give 10 minutes, then how are we able to educate people about this? Which is why it's wonderful to have people like you who are doing some private work, people like Roman Chatterjee, who's really reaching millions and millions through his sort of health and wellbeing podcast now. And gradually things are changing, but it is gradual.
It is. And I think it's also a shame we don't have time to look at people's lifestyles, you know, simple things like how people eat. You know, we now know what you eat. You know, I say to people, food is medicine. You know, think of your food as a type of medicine, in the sense, if you eat well, you'll feed your gut microbiome well. That'll promote lots of good bacteria. That will then give you better mental health and physical health. And I think, you know, if you think about how many resources say just about nutrition or diets and things on the internet, but actually it's really not very difficult what you eat. In the sense, if you have plenty of fruit and veg, or you have fiber, or you cut down on your sugar, don't snack too much. Maybe
you don't eat too much sugar, you don't eat processed foods. I mean, it can be very simple, can't it?
You can actually, you know, cut it down to about 5 things really that you should consider in your sort of eating pattern. You know, it doesn't have to be complicated.
And how much effort is your body having to go to metabolize all that sugar and all the heavy foods, all the processed food that you're eating? And
the other thing I find with patients quite often is sleep is a problem. But how many people are sort of, I don't know, using screens and till late at night, and then going to bed and thinking, why do I have trouble falling asleep, or I keep waking up? And you know, the concept that these screens are sort of telling your body it's daytime. And also, if you're watching the 10 o'clock news before you go to bed, you know, that increases generally people's anxiety, particularly at the moment with what's going on in the world. And then it is hard either to stay asleep or fall asleep. And just simple things about, you know, what do you do that hour and a half before you go to bed? Can you start telling your body and yourself that it's time for sleep? You know, turn things down, turn lights down, screens off, maybe listen to podcasts, potter around your house a little bit, do a few bit of stretching, listen to the radio, have a bath, do other things that will just calm your system down. I think that, you know, these little things can really help.
I think
in
that's the
overall
thing.
health.
Often people think it's too simple. These are too simple. But actually, life was very simple before we got all so technically minded.
But
And
also,
yeah,
if we don't sleep well, we all know how bad we feel the next day. Our
yeah,
pain is worse, our headache's worse, we're more irritated, we're more triggered,
yeah,
you know.
yeah, absolutely. So just going on to Lynn says, eat food, mostly plants, not too much. Don't eat anything
Yeah,
your grandma would not recognise. Yes, very
that's
true, Lynn.
absolutely true, Lynn. Yeah.
Yeah, yeah. And these days the news is constant. You're getting notifications on your phone all the time, and that's not even notifications all from social media as well, but just sort of news ones. And there are so many things you can do with your phone to just sort of switch things off, to stop the notifications. Don't get the news notification all the time. Don't sit, like you say, don't sit and watch news, late at night. Just watch the highlights. We don't. The problem with the news is it's not just the highlights. We don't need to hear about whatever horrendous thing has happened, and then talk to every family member about how they feel about what happened. And going into it, and by then we're just so drained. And if you're a highly sensitive person as well, it is very draining. And so yes, so many simple things, but we're so used to being busy and doing all the time, and looking at screens, that there's so much out there now about healthy living and lifestyle, but there are still so many people who are unaware of the simple things that can really help us. And it's because it's about stepping back and stopping trying to do so many things. And keeping away from the screens and everything, and the bright lights at the end of the day. And lots of things we can do for sleep, definitely.
I think a lot of things in our lives that we're doing, like the screens, news, busy, are just obviously, overstimulating our nervous system. So a lot of us, and a lot of my patients, I find, are living in that fight, flight, anxious mode without realizing, and it's become their norm.
It's normal.
And then it's normal for them. And I say to while you're living in this state without too much calm, then your symptoms are going to be worse here. Whereas if we could just calm your nervous system, so you had times in your day where you had time out, you did things that you enjoyed, like being in nature, walking, listening to music, whatever it is that's personal to you, to calm that system down, then you'll live in a calmer state. You're going to start noticing more of the ebbs and flows of your symptoms.
And using less things to distract us. And I know that for me, one of the things that I used to distract myself with was reading fiction. And I'd get completely absorbed. And now I go through phases, when I will read fiction, at other times I don't. But what I find is that if I'm reading a thriller, for example, that really revs my system up. And if I'm a busy life anyway, and then I sit and relax and read this thriller, I'm like trying to read quickly to see what's actually going to happen. But that in itself is not just distracting us from how we're feeling, but it's actually triggering a load of feelings as we're increasing that fight or flight, wondering what's going to happen in the book. So reading, even if it's a romance or whatever, can still be a distraction from how we're actually feeling ourselves. And so people are so used to looking outwardly, reading books, watching films, keeping busy, looking at everybody else doing, looking at screens, sorting out social media, that most people are unaware how they're feeling. And it is about turning their attention inwards and then encouraging people to start really started to notice when they're triggered, when the buttons are pressed, rather than waiting until the pain comes on or they lose their rag or whatever, but to actually start to notice before then when the buttons have been pressed, by changing their breathing or by sensations that they're aware of in the body. And that's why we in our work now focus on that quite a bit, to really start, if symptoms, mind-body symptoms are a result of not acknowledging emotions, then the more we can learn to tolerate these emotions and allow emotions to surface and be processed rather than avoiding them, the less likely, the less we need the symptoms to protect us from what are being perceived to be these scary emotions.
Yes, and I often, think those scary emotions, that reaction, that anger that we suddenly have over X or Y, if we start understanding that's a trigger to our emotions, we can start using that more positively.
Yeah,
So having
definitely.
the awareness, oh gosh, that really triggered me. I have to say, angry older men really trigger me. And I didn't realize for years why I almost used to feel tearful in front of them. Well, of course, it's because I had an angry father, like it triggers me back to being
Yeah.
that frightened child. So, you can, once you start recognizing and understanding your triggers, you can then start understanding, okay, what's the emotion in me that
Yeah.
I feel. I think naming emotions is tricky though, isn't it, for people, because we're
It
so
is.
not used to naming our
Yes.
emotions. People know sad, happy, whatever, angry or something, but they don't know to name your emotions is hard. I do use the emotions wheel quite a lot,
Yeah, I was just going to say the emotions wheel can help, can't it?
yeah,
Definitely. Yeah.
hugely. And you can buy emotions cards and things as well, can't you? That tell you,
Yes.
what this means. Anger is often sadness or fear or other emotions underneath. And I think those kind of
Yeah.
tools are really helpful.
Yeah, because for example, people who are learned from growing up, maybe they had a raging dad and they learned that anger's dangerous,
Yeah.
or maybe they became angry and they were hit because they lost their temper and they would get angry, so they learned not to feel anger. And I certainly worked with an elderly guy who he was in his 80s by then, actually, riddled with chronic pain, and he had grown up very, very poor, and by then, by the time I saw him, he was a millionaire. But he was grew up very poor, very, very poor, and with a very, very angry dad. And he just said, "But I never feel angry. I never feel angry." And I remember on one occasion saying to him, "But so you've just lost a few £1 million deal that you've been trying to go through for the third time because somebody pulled out, which has cost you a lot of money. How do you feel?" "Well, just a bit frustrated." And he was
Yeah.
so
Yeah.
unaware of any felt sense and unaware that frustration is a subsidiary of anger. And that's all he was allowing himself to feel. All his primal brain was allowing himself to feel. And so it's about
Yeah.
training ourselves to learn, isn't it? But the emotions wheel can be really good. And even if you can't name it, to just feel it,
Yeah.
to actually be still and just
Yeah.
notice and track what's going on in your body is a way of
Yeah.
building your felt sense, which can only help.
Yeah. And it also gives there was an anagram, and I can't quite, sorry, off the top of my head, I'm just trying to think what it is. Alarm, like it's you're bringing up emotions of abandonment, loss, rejection, mothering too early, shame, you know,
Mm-hmm.
things that we don't necessarily recognize till maybe we work with mind body practitioner. We start really thinking about our lives and who's been
Yeah.
involved in our lives, who's been in our families and growing up, etc., that these things have happened to us.
Yes. Yeah. Yeah. And they cause scars basically.
Yeah, yeah.
Yeah. And then
And
it's
so
sort of
when we're triggered
understanding.
again, it's our emotional memory, is timeless,
Yeah.
and we're
And yet
triggering
it's
those emotions.
the triggering. It doesn't necessarily mean we need to go back into the past and start really doing all this talk therapy around that, which has been shown with people, for example, with PTSD, to actually be re-triggering them all the time. But when,
Yeah.
like just said, they're old patterns, and so if we like you just said, if you see an angry man in front
Mm,
of you, that it would trigger you. It doesn't
mm.
mean that every time that happens, you then need to go and journal about whatever. It
No.
might be helpful to journal about it, but it also can be helpful to just sit with what's coming up and to
Yes.
then explore that, and not necessarily explore that in your head at that time, but to work through that somatically, and then to maybe explore, maybe using a journal to say, okay, so
Yeah.
what happened? So you begin to
Yeah.
start understanding it, and then you can start preempting it.
Yeah. And I think that getting out of your head into your
Yeah,
body is really important, because
yeah,
if you're trying to solve it in your head, you'll just generally go round and round and round and get lost in kind of all these thoughts.
Yeah.
Whereas actually, if you bring it into your body, it tends to ground you more, I think, doesn't it? Do you think?
Absolutely, but
And
that's
then
hard.
breathe through that.
And I have, I do this. I've done it for every client that I've had, certainly in the last few years. And the amount of times people will, maybe I'll just say, come out of your head, do some breathing. What are you aware of in your body? Nothing. So bring to mind somebody you love. And have you noticed a shift in your body? No, nothing. So I'll sometimes say, well, what about a bit of warmth or fullness? Because we're so outward looking all the time. But quite often when I will say something like, okay, so think of something, of maybe doing something that would cause pain, or bring to mind somebody that you're cross with, then I'll say, what are you aware of? I'm angry. I'm really angry because, no, that's in the head. Go back to the body. What are you aware of in your body? The sensation in your body. And it's constantly going up, down, until they get it. And there is that aha moment, isn't there?
Yes,
when people do just, and I have that, when it's like, oh, okay, now I get where you're coming from. Yeah. And then you can build on that then. But it's so challenging to begin with, because we're always in our heads trying to explain everything.
Yes.
And understand and analyze and whatever.
Yes, and fix it.
And
I think it's a little bit about going out of that brain into a slightly more adult, not trying to fix it, and trying to feel where it is.
Yes.
And sit
with curiosity, that big word.
Curiously,
curiosity. And it brings to mind a patient that I had who had restless leg syndrome. It was just years ago, and I remember trying to explain about emotional awareness and about being somatic and about curiosity and not resisting it, because when you resist it, you're fueling the pain. And at night, she always used to start feeling the irritable legs, and then she'd sort of, there's a moving, and she'd get up and she'd stamp her feet on the ground, and she'd sort of have to keep getting up and be wandering around for about an hour every night. And I was trying to encourage her to, when it started coming on, just calm her breathing down and just observe, just notice what's happening in your body, and don't resist it. Just allow it. Just be curious, see what happens. And she said she was so amazed the next time she came, because she said, I did that. And she said it was like an electric shock went through her whole body, but it all just went up, and then it just went woof. And we're so scared of what might happen that we resist it. And on this occasion, she really could see that actually when she allowed it, then it came up, and then it just dissolved, and she was able to go to sleep. And then it got easier as time went on.
I think that's really interesting. And also, how people get in these learnt pathways with their pain and restless legs, and how fear is the fuel to the fire. It just keeps going, that anxiety and fear. And often I say to people, fear sort of tends to drive this. Oh, no, I'm not fearful. No. I'm just incredibly frustrated, despairing, annoyed, angry. I go, well, those things too are driving it. These other things we name. We don't often recognize the fear.
No, absolutely. And what are the ones that we'll come to the questions in a moment, but this is where Howard talks about his 5 F's, doesn't he? He talks about 5 F's that can drive pain. So trying to fix it, frustration, fear, fighting it. What's the other one? Have I got?
Gosh.
There's a 5th one, but anyway.
There is. Sorry, I can't think of it. Yes.
I usually write it on my board over there, but I've rubbed it all up and using it for something else, because I always remember 4 but not 5. But and you can see how, the more you're, actually, wait a minute, frustration, fix it, trying to finding a solution. So maybe that's to fix it. Is that to fix it?
It could be finding a solution, though, because often people are looking for the solution, so they're not actually working on themselves. They're looking externally, not internally. But I can't remember the 5th. Sorry.
Yes,
off the top of my
maybe
head.
somebody else will know it here. They can put it in. So Lynn, could you say something about expressing your anger, because when you do so, it upsets other people? Okay, it depends how you do it. Do you want to comment on that, Anna?
I think it depends how you express your anger. So I think, I don't know whether this is helpful. I listened to an American psychologist, Michelle Chalfon. She talks about the inner child, which is your emotions, your honest, spontaneous person with inner emotions. Then you become your adolescent, and the adolescent tends to be the I'll fix it. I'm being judged by people and I'm reacting because any emotions that come up, I want to push them down, because if I'm 15 years of age as an adolescent, if I fall over in the playground, I'm not going to cry. So they hide their emotion. And then you can move into the adult, which is the person more in the present mindful moment. So in the moment, what's true, what's fact, etc., and can sit in that mindful moment. And the parent can parent the child in us. And I think anger, we need to think where we are in that emotional state of anger, because often I think we're in our adolescent of reacting in anger.
Yeah.
So someone annoys us and we just react. And that's quite sort of, it's about defending ourselves. It's about our ego, which is driven in fear. And so we react from that position. And I think that's not a helpful expression of anger towards other people. I mean, if you want to go away and do it in the bathroom, you know, quietly in the room on your own, fine, okay. But to other people, they will then probably become quite defensive. So it doesn't land well. I think you need to kind of take some time. You know, I often say things on day 1 are pretty bad. Things on day 3 look a lot better. That's my mantra.
Yes.
So if you take some time just to think, right, what's true and what's fact here? Okay. Can I ask that person or present to that person, when you said this, I felt X, Y, and Z, which really upset me, then that tends to land better with the other person. You're expressing why you felt angry. And then you can have
not blaming them.
Conversation. Yes. Does that answer your question, Lynn? I can't see you, so I don't know whether that answers
Lynn said, thank you. I guess I'm reacting as an adolescent.
Well, I think most of us are actually, Lynn, to be honest. I think I've spent most of my life reacting as an adolescent. And it's as I learn more, I move into this more, try and move into this more adult, being in the moment, what's true, what's fact. You know, what they said, they probably didn't necessarily mean in the way I interpreted it. So I'm going to just respond to them rather than react to them. I don't know, is that helpful? Have you got more to add, Georgie?
Well, I think by becoming more emotionally aware, then we are going to help ourselves be less reactive. But we're still going to be triggered, obviously. Certainly I found that rationalizing it, journaling to offload, putting it into perspective, seeing it from that person's point of view, whether that's through journaling, through like a chair technique, which I have found to be hugely helpful actually, to, you know, imagine that person sitting in a chair and then I rant and rave at that person. And I've done this at one particular time I was thinking of. It's either a 2-person or 3-person chair when you either have you and the other person, but you can have a mentor as well. So somebody who can then feed back. On this occasion, I just needed me and this other guy, and I just was ranting and raving and actually thumping the chair because I was so angry. So for me, often having a physical expression can really help. Whether it's thumping a mattress or a pillow, going for a walk and just doing that and getting in nature and expressing that, because trying to rationalize before we felt the full emotion can be challenging. But rather than going and ranting to somebody, I tend not to do that anyway. But I would, you know, certainly doing it through journaling and a more physical approach as well can really help. And certainly what changed it for me was when I then sat in the chair as him and he responded to me And oh my goodness, on that occasion, it was a complete turnaround, and I could absolutely see why he had been so angry. And of course, it was about work and not somebody, a doctor, not being fully on board with this and being rude to me. But I could really see it from his point of view as a retired doctor who's spent his whole career. And now some upstarts are coming to tell him that actually, no, you were wrong. You know, your whole career on chronic pain, and you were wrong, which is not what we're saying at all. But I could see, and if you're the person that's going to be triggered and be angry, then yes, that would come out in that way. But I do think that, you know, if we deal with our frustrations, we're less likely to feel anger. If we deal with any of the other emotions, then obviously it's going to help us, prevent us reach that point where we're not expressing how we feel, so then we just end up reacting and getting angry. But when we do get angry, it's about not taking it out on other people, but taking ourselves off somewhere. Use a punch bag, journal, chair technique, go for a walk, go for a run, just go out in nature. But I think one of the important things is not just to start thinking about, I need to self-soothe, I need to calm down, I need to do my meditation and self-soothe and do my breathing. Great, yes, please do. But that's so much harder unless you've done the ranting and expressed how you felt beforehand. Otherwise, you're just repressing. You're distracting yourself from really how you're feeling.
I think that's brilliant. I love the chairs and things, because I've just changed some of what I'm doing actually to deal with something quite stressful that I'm a little bit, I say, angry about. And I do this thing where I do a few minutes mindful movement, and then I was doing some meditation. But in fact, instead of my meditation at the moment, I'm going in a room, shutting the door, no one can see me, and I'm putting on music and I'm moving to the music to express physically how I'm feeling. So I might do a quick journal of what my emotion is, and then putting on music and expressing it to music to physically get it out of myself rather than hold it in.
Yeah, absolutely. And that's why I do a shaking meditation. And that's why on occasion in the past, when Zoe worked with me, if we were just feeling really pissed off in the morning about something, we would put some loud music on and we would just dance around the room. Anyway, I'm just going to go back to Luke, because Luke says, certain activities cause me certain pains. Very predictable. How do people break a conditioned response? And that's something that we're constantly helping people with. Do you want to start with that, Anna?
So I think for one, you need to be aware what is the condition. You know, every time I go for a walk, I have back pain or whatever it is. Okay, and in a way, what you need to start understanding, I think part of that sometimes the worry about the structural issue. Some people have an issue that they're worried they're doing an activity that is making their condition worse. So I think you need to move away from the fear of having a structural problem. And then I think it's things like sometimes journaling about it, but also things like visualization. So start imagine yourself on a walk and imagine yourself walking without pain. And then what you may do when you go for a walk is you may need to talk to yourself to calm that nervous system. So you may start talking to yourself and be curious about any symptoms and start talking to yourself like, I am safe. I have nothing wrong with myself that will make my condition worse. I am safe in this situation. I can walk, and just talking your way through it, really. What would you say, Georgie?
I completely agree. I mean, we don't actually know what the conditioned response is, but I would say absolutely visualization, using emotion to really feel how you feel. But even if it's, okay, every time I wake up in the morning, I get pain, then through the day, even for a couple of minutes, a few times a day, imagine yourself waking up in the morning and just sort of feeling wonderful and stretching and looking at the sun coming up and feeling wonderful. And it's the feelings that really reinforce these neural pathways. So whatever this conditioned response is, first of all, like you say, Anna, sort of definitely notice what it is, what's going on, reinforce your understanding. Okay, so great. So Luke says back pain when walking was example. So a good example. So great. And starting gently as well. So, and I remember, for example, somebody who had back pain who couldn't swim and couldn't go to the gym and was scared of swimming. So the first thing I did was say, well, put your gear in the car and go and drive to the gym and sit in the car park. Don't do anything, but you're visualizing it all going beautifully and really enjoying it. But it's not sort of the sharp cold therapy with wow, getting that tub of ice water or whatever. I don't believe in people pushing themselves to that limit. To just do it gently and kindly with compassion. And the next time maybe go in and change in the gym and then walk around and then go home again. And I've done this with a number of people and just gradually just increasing their I can't think what the word is I'm looking for, but they're getting more and more used to it. But visualization is hugely
as well by doing that. They're not putting themselves into a fight or flight mode. So they're keeping themselves calmer, aren't they, by just doing minimal amount of it and then building up their confidence through being calmer.
Absolutely. Yeah. And using, like you said, supportive self-talk, calm emotions, calm breathing, reassurance, and when you're on a walk, not sort of looking, is the pain coming on, what's going on, but actually walk with somebody and talk to them, or go for a mindful walk and observe every time a foot touches the ground, just notice what's actually going on, or go for a mindful walk. I've done this before, where look for the different colors that you can find, or I remember going on a dreary day and just trying to find a bit of color. And so my focus was on looking for color rather than whatever it was that I was having a tendency to ruminate on that day. But I hope that helps, Luke. We've got another question from Claire, who's experiencing a flare-up of pain after several pain-free weeks. I'm finding it very hard not to slip into doing those 5 Fs. Oh yes, the other one was focus. Thank you for that, Lynn. That's the one I usually remember. That's the one I forgot. So she's finding it hard not to slip in the 5 Fs. Any tips for coping with flare-ups, please? I think part of that is the terminology, a flare-up. I think part of that isn't helpful, whereas actually looking at it as a learning opportunity and go, oh, okay, this is interesting. What's happened here? And being curious again and calm about it, and using all the somatic work, and to really just take that time to explore this. And every single person who's gone through this that I've worked with, Claire, have really found that that they're really glad that they had these when they've gone through them. I know it's hard when you're going through it. You can't go back to where you were because you know too much. But pull out your evidence list. If you haven't got an evidence list, start writing down things that you could do when you were pain-free. You've had several pain-free weeks. Look at what your life was like. Write down things that you could do that you can't now. Have you had a major accident between now and then? Has anything, really prove to yourself, look at the evidence, the references, as well as your own evidence, to really reinforce that everything's okay. And if you're noticing any of those, the 5 Fs, I would say start really practicing things like the pause, breathe, feel, reassure, so that every time you're aware and going into fear or focus or anything, or just you've been triggered, to get to pause, notice your breathing, because your breathing will be dysregulated, no doubt about it. That's the first thing that happens when you go into fight or flight or freeze. And just notice what's going on. So pause, slow your breathing down, and then notice, just feel, curiously observe what's going on. Keep your breathing calm, allow anything to move about, surface, just track what sensations are there, and then reassure yourself. And that's actually by just saying, do you know what, this too will pass. Everything's fine, we're safe, we'll be all right, whatever. There's more, but what would you add, Anna?
I mean, I would say that, look, you've been pain-free or symptom-free before. So you've got that reassurance that you can get back to that. Like you,
Yeah.
I'd go for curiosity. Okay, this is unusual. Why have I got this? What are my emotions? Where do I feel it? Going back to that kind of concept, or has something happened in my life? Has something happened at work or home or whatever? And then I'd really go back to basics. I do ABCs very similar, awareness, breath. And the good thing about your breath is you've always got it. You can never leave it behind. You can't go on holiday without it. You can't go to the seaside without it. You can't go to the shops without it, or wherever. You've always got it with you. You've got it with you in the car. You've got it with your work. You've got it with you all the time. I get people often to put up a picture of the polyvagal chart, polyvagal theory, on their fridge or on their desk or something, and just check in with themselves at intervals in the day. Where am I on this? Now, if you're about to give a talk or something, you're going to be up in a bit of fight or flight. Well, that's normal. Okay. The question is, are you going to come down afterwards? And I think when you're having symptoms, you just have to recognize the likelihood is you're either in fight or flight or freeze. And how can you bring yourself back down to a calmer state? And that's, like you were saying, breathing, journaling, somatic therapy,
Nature,
all these other things, nature, walking,
music.
find those things in your toolbox that you use. What's your emotion? Where are you feeling it? What's in your toolbox that you use to help calm your system?
Absolutely. Yeah, absolutely. So I hope that's helped, Claire. Luke's saying, knowing the pain always happens makes it hard to think about other things. I get that, Luke. But there's the focus on the pain. So obviously that then makes it more difficult. The more, I know it sounds ridiculous, but the more you can become more lighthearted and inquisitive and curious, the better. Otherwise, because I can guarantee that the pain won't be exactly the same all the time, it will fluctuate. And so the more you can build your felt sense and start to really work on that, and self-soothing and self-regulating, which aren't the same. The self-soothing is calming things down. Self-regulating is actually being able to tolerate difficult emotions and allowing them to pass through. But going on a walk, absolutely do the self-soothing, and maybe just gradually build up, like we were saying before, and absolutely use visualization. And if you struggle to use visualization without focusing on pain, maybe think of in the past something that you really loved to do, something that I don't know, that you used to do that was fun. Maybe you were a child or a teenager. Imagine that. Your brain doesn't know whether it's actually happening now or in the past, but imagine what that was like. Okay, or even putting the words "what if"? What if I could walk freely and easily? Then that then allows you to start thinking, okay, so what if? What did it feel like? And then allow yourself to feel that and then visualize it. And the more you're doing that, the research is there. Olympic athletes use visualization. If you haven't read David Hamilton's books, how your mind heals your body, something like that. There's a lot of evidence there for visualization, self-talk, gratitude. But the more you focus on the pain, and if you want to read another book, The Expectation Effect by David Robson, you expect pain, you get pain. You expect, whatever you expect, we get. Even to the point of, in his book, he talks about having a bowl of food, and you're told, a group of people were told that this is a really rich, loads of cream and butter and everything. It's beautiful, but it's really calorie laden. To this is a low fat one, low sugar, low fat, whatever. Even if they were exactly the same, the people who believed that it was full of fat and sugar and everything put on weight, didn't put on weight. The body reacted as if it had, it was, so down the line they would have put on weight. But what we expect, we get. and it's a fascinating read, and it's not just about health and well-being, you know, sports as well. So the more you expect your pain to get your pain, the more you're going to get it. So the more lighthearted you can be, treat it as, you know, an interesting exercise rather than, right, I've got to do this visualization, and I've got to make sure that it's right, and I'm going to go on this walk, and I've got to make sure that I can walk 100 yards without pain. There's a lot of pressure there.
Yeah, you have to remember, it's not homework.
No,
You know,
no.
it's a journey, and
Yeah.
it has its ups and downs, and sometimes just going back to those basics and what are the emotions, where are they, what can I do to make myself feel safe, connected and loved, you
Yeah,
know, those sort of basic
absolutely.
things.
Yeah, absolutely. And you know, if you walk a few paces and you would have had pain, but you don't, you go, I got you, I got you, you know, and really just making it a bit more playful. Anyway, we are up to an hour now, so I think we will move on. But thank you for your questions. It makes it much more interesting and fun for us all, I think. So thank you very much, and thank you, Anna, for joining me. Great.
Oh, you're very welcome. Pleasure. Thank you, everyone.
Good. All right. Take care, everybody. All the best. Bye.
Bye.